My brother and I were talking yesterday about how we wish there was more awareness about health and taking care of ourselves when we were younger, learning more about what we need to do as we get older, because guess what? We're facing some kind of health dilemma. So, this is MC. I have a doctorate in health psychology. I've been doing research for the past 25 plus years. And the truth is, I'm fascinated by health. I'm fascinated by understanding health and how it is that we can do what we need to do daily to give ourselves the best potential for having a long, vigorous, functional life into our 80s and 90s. And I'm sitting here right now thinking how I will be grateful if I have another 20 years. We have this issue about our health that sometimes surprises show up, and then we have to pivot. I think that's what life is all about, is how do we learn to pivot? So let's talk about it. I want to talk about pivoting in our health and wellness as we get older. So please think about subscribing. Like I said, this is MC of Healthy by George. I come each week to talk about all things health and longevity because I really truly want to motivate myself and others to do what we can daily to keep ourselves vigorous and thriving so that we can be functional mentally and physically well into our 80s and 90s. Please join me here and let's motivate one each other to do what we need to do because that's what it is. It's a daily investment into our health and well-being, both mentally and physically. So why am I talking about this? There's so much upside downness in the world, and someone brought up the whole issue. I had a very long conversation with a very dear friend about caregiving. I was a caregiver for my husband who had multiple sclerosis for over 17, 18 years. And I was so fortunate that I had resources. I had resources where I could get what's called visiting doctors to come and see my husband, which kind of helped reduce the stress and challenges of getting him, who doesn't move well, to see a doctor. We had visiting nurses who could come in and help with certain things which we would need because of situations. He had other problems. He had a heart condition. He was having some cognitive decline, and movement was always a big challenge for him because MS affected both his vision and his balance. When the doctor tried to explain it to me that multiple sclerosis feels like he is walking through a sideways world, he doesn't feel like he knows where he is in space. And I really think that as I think about growing older, my husband lived till he was 70. I'm going to be 70 in 3 years. And a great deal of the people on my father's side of the family, they passed away in their 70s and maybe even earlier. My grandmother passed away earlier. My uncle on my dad's side passed away earlier. You recognize that there are certain health conditions that exist in your family history. And what can you do to help yourself? On the other side, my mother has a very longevity in her family. Her family, some of them lived into their 90s. And even her parents, who had some health conditions, lived into their 80s. It's hard to know what to expect. And how do you plan? How do you plan for the kind of caregiving that you might need as you get older? And I think that's becoming more and more challenging because the caregiving that's being established, these skilled nursing services, or they call them skilled living facilities, or all kinds of things where there is support and help for possibilities of conditions where there's a balance problem or a cognitive problem or just some general health issues that you have to stay on top of because of their uncertainty. So all of these things are to be considered, but I feel like the price of what some of these things are costing is exorbitant. And also, too, do people really want to move away from their homes? I don't think so. I think many people, like when my father was dealing with his issues of health and well-being, he didn't want to leave his home. I don't know if I would ever want to leave my home because It's where you feel you belong. You feel comfortable. There's a sense of knowingness that you've created. So, how can we plan to have a process for ourselves that will give us support? It will give us a feeling of being nurtured and cared for so that we can gradually figure out what it is we need well into our 80s and 90s. And I don't think we start thinking about that until it's very late. You don't want to be knocking on the door of a skilled facility when you desperately need it. You want to already have things in mind, a plan. When I was thinking of my surgeries last year, I had a plan. Granted, there were some things that happened that were unplanned, but I was grateful for the fact that I had a plan of how I would get home, how I would work at home, how I could have some home care. But it took some planning. And it wasn't cheap. When I did my taxes, I saw how much I spent on all of that health care. And that was out of pocket because the things that I was making sure I had weren't things covered by our medical coverage. They were outside of the medical framework. Yet, even that, with the unexpectedness of what happened with me with my hip replacement, where I had to go back in and have a second surgery because of some kind of a hematoma, which is a blood clot where there was just a pooling of blood up underneath the incision that was unexpected. That was also something that was very challenging to deal with insurances and how to make sure it gets covered. And believe me, I think that so many things about how our wellness must be addressed. And that's really the key. It's not about being conscious about our illnesses, but how can we be more conscious about our wellness? Working with our doctors so that I love how Peter Attia talks about medicine 3.0, that let's not wait to just fix something when you've been diagnosed with a condition, but let's go ahead and optimize our health and our well-being right now. In this moment, what can we do to optimize our health and well being? One, the key thing that I keep telling myself and I keep pronouncing, because I find movement to be difficult, but I know movement is king. Any kind of movement, a little bit of movement. If you're doing some movement throughout the day consistently, working with yourself in flexibility and stretching and lifting weights and doing balance exercise every single day for 5 to 7 minutes, and then going for a walk or doing something, some simple yoga positions. All of those things contribute to a healthier longevity for ourselves, a healthier way of being. And I think that's something that yesterday was the first day I had missed doing my extra exercise routine in the afternoon. And frankly, I know I was tired. And today, again, I'm feeling tired again. But you know what? I'm still going to do something before I go to bed. I'm going to do a 5 or 10 minute little movement. It's going to be just some simple yoga positions, simple balance positions for 5 to 10 minutes because I definitely want to invest in my longevity. I want to invest in myself being the very best version of myself into my 80s and 90s. And what does that mean? It means being committed to doing what I need to do today. Just like we invest for our retirement, we want to put in the money today, so it's going to be compounding to a bigger number later when we need it. I know this is a hard concept, frankly, because so often, and I feel that way too, like I want to throw in the towel. And I know too much. That's really the problem. I know way too much about health and wellness and cognitive decline and physical decline and balance. I know too much. It's really tough. Basically, I have to really work with myself and remind myself of the things that I know because the unexpected is a part of our aging process. We never know what's going to show up. It could be an easy trip and fall, and we've broken a leg, or we've injured our knee, or we've broken our ankle. It can be something simple. You get a rash, or you have some kind of a spot on your skin that shows up, and suddenly you realize it's melanoma. There's just so many things as we get older because our immune system is just not as functioning as well as when we were younger. So it's about being vigilant to keep ourselves in the best physical, mental possibility that we can. And it's so hard because unless we're doing something every day, which I'm going to start doing, I ordered for myself, which I am not surprised. The Hume band, Hume. It's a band that you wear, and I'm not crazy about wearing things on my wrist that will tell you certain things about movement, metabolism, and basically your sleep. I really want some of these kinds of things that are hard to understand. And what I do know is the more that you can understand them, the daily aspects of these elements. And I'm going to share it here on the channel. I really want to understand how some of these behaviors that I have of moving, how do they really contribute to the long-term benefit that I'm going to receive? How does my sleep and the way that I'm sleeping either help or deter my long-term wellness? I think for the first time in forever, we have the ability, granted it's rather simplistic, but this is a huge black hole where we've not been able to look into for years. And in aspects that are as highly skilled as these new bands and rings and watches can do that help us understand what is our body doing. Because so often we're the last one to know. We find out when suddenly there's a big problem. So I don't want to wait. I want to start see where am I with my heart rate variability, which is a big indicator. How well am I sleeping? Am I getting REM sleep? I have no idea. I know some days I feel rested and some days I don't. I think all of us are feeling an amount of stress. I feel very stressed about how things are going on in the world. It really is very stressful. I feel stressful about our economy. I feel stressful about what's to be coming in the next quarter and how can we deal with the stress that's going on in the world and then also manage our own internal stress and stay centered and focused. I've been leaning on my habits of meditation and mindfulness, and it's really helped. But the minute I turn on the television or watch a little bit of news, the stress level goes back. So we have to be intentional about how we are helping ourselves. And I do know that meditation is key, journaling is key, moving is king. And if we can do those three things every single day to help ourselves manage the stressful issues that are going on in the world and the economy, we're going to give ourselves a fighting chance to have the best version of ourselves be present as we grow older. It's hard for me to think that I'm only going to have 17 more summers or 17 more Christmases or however many, 20. Maybe I'll be lucky and get 20 more Christmases or 20 more summers. That's not a big number. That's a low number. So we need to be intentional. If you're younger, think about it. Make every day count because reality is no one is promised tomorrow. We hope we're going to be okay for tomorrow. We hope we're going to be okay. I do, in other words, for the next 5 or 10 years. But no one knows that. We all have the potential to suddenly have something unexpected happen. That's either for our finances or for our health. And it's more likely what's going to go on in our health than our finances. I think some of our finances, we can figure that out. Our health, on the other hand, I think sometimes can be a bit of a mystery. So remember, we have this one precious life. Let's live it to the fullest and let's give ourselves every single day an investment to the longevity of being the very best version of who we can be into our 80s and 90s. I know that's what I want, and I want that for you too. I want you to be thriving and vigorous well into your 80s and 90s. I want that so badly for everyone because truthfully, each one of us is such a gift to the world, a gift to your community, a gift to yourself. And I deeply believe that. So please think about subscribing. I would love to see you here and share. And how are you giving to yourself every day? Are you doing any journaling? Are you doing any mindfulness practices? How are you managing your stress that we're all encountering with the things that are going on in the world and our economy? Tell me what you're doing. I would love to hear new ideas, new ways. Are you painting? Are you going out and picking flowers? Are you collecting things? I would love to hear all about it. So be well, my friends, and please think about subscribing and clicking the like button and share. I'll see you next week. Bye-bye.
So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.